Doctors of Reddit, what is your most awkward experience when dealing with members of the opposite sex? NSFW. We are taught to explain to patients exactly what we are doing. As we are doing it, delicate wording becomes important during female pelvic exams. Instead of "okay, I am going to place the speculum inside now, so you'll just feel some warm pressure," my buddy ended up saying, "Okay, I'm coming inside you now." The female patient responds, "No thanks, I already have 3 children." Edit, not in Arkansas. Sorry folks. Also, my username is in reference to this, and no, I did not participate in this research. I just think it's pretty baller to have robot sperm. My granduncle is a urologist and I got a boner from checking out one of his nurses when I was around 12. I then had to explain why I couldn't drop my trousers for an examination. He asked if I wanted to go to the bathroom to do something about that so we can continue the examination. I had no idea what masturbation was and he explained rather vaguely to me the gist of the operation. I didn't feel like trying it, so we just sort of waited until it went away. I don't know if it was awkward for him, but whenever I think about it I cringe myself into the fetal position until I can block it again. Doctor here, recently walked in on a new mother in a sitz bath with 2 breasts pumped, sculpting away at her all the while her husband grins from ear to ear as I worked her up for a pubic bone injury. The newborn could sense my embarrassment. Not me, but a fellow classmate in medical school. We have mock exams, and various people will sign up to be patients. They get paid a decent amount. So he went in the mock exam room and started the basic history and physical on the fairly attractive female. Did this and that pretty standard stuff, grabbed a tongue depressor and had her open her mouth. Then, nothing, he did it again, and said with bewilderment, "That is weird, you do not have a gag reflex." She smiled and gave him a coy wink. He about lost it and couldn't finish. He walks out and finds the preceptor who monitors the exam about rolling on the floor laughing. As for me, I never really had an overly awkward experience other than maybe knowing someone, which can make certain exams a little awkward. I was the chaperoning nurse, young doc, first week in OB and was seeing a early pregnancy PT and triage. Docs usually say, "I'm going to put my hand on your vagina now, or you will feel the speculum on your lips/labia." He was rattled and so nervous he conflagrated them as, "I'm going to put my lips on your vagina now." The patient and I roared with laughter for a second before we controlled ourselves. He shakily kept his dignity and kept right on going like nothing happened. He never referred to it again for the 4 years he was there. Not a doctor. Student rad tech had a patient for a regular chest x-ray series, but she was coughing up sputum. I asked her if she wanted a tissue to cough it up into and she said she didn't spit, she was a swallower, and winked at me. I'm 19. She was 98. I had one patient who had made her desire for me very public, but since I treated her entire family, I decided not to kick her out and continue to remain professional. In the midst of a bipolar mania, she kept complaining of female issues. During her pelvic exam, I happened to look up and I saw a gigantic smile on her face. After the exam, in the hallway in front of a few residents, she said, "If you weren't my doctor, I'd fuck your brains out." Perhaps I should have mentioned this earlier, but she was the only woman I've ever met who was a 0-10. She's the only patient who made me question my heterosexuality. Somewhat related, but from a patient's perspective. When I was in nursing school, I went to my school's student health center for a gyno appointment. The doctor asked me if it was alright if a medical student was present. I said that was fine. She then specifies the student was male and asks me if that was still okay. I wasn't totally comfortable with that, but as a nursing student I knew how much it sucks when a patient refuses you, so I said yes. Lo and behold, it was an incredibly attractive med student from my school who I bumped into all the time, and he saw the inside of my vagina. I never could look him in the eye after that. Edit, a lot of people are commenting that he or I should have refused. I didn't actually know the guy, I just knew him as a hot stranger. And I think I became much more aware of his presence after this occurred. When I was 16, I sometimes got dizzy if I stood up really fast. I'm pretty sure this is relatively normal, but my mom thought something was wrong with me. So she took me to the doctor, and he wanted to check for testicular cancer. I had a worried look on my face because I didn't want an old Asian man feeling my nuts. The doctor saw my face and thought it might console me if he spoke teenager. He said in his Asian accent, "I'm gonna feel up yo balls." I felt pretty awkward after that. My attending tells me to go examine a patient, her chief complaint being that she was beaten up by her boyfriend. So I go in to see a tall, very attractive blonde sitting there crying. I calm her down and ask her the usual questions, and then I explain to her that I have to examine her from top to bottom to document the injuries. So far, the exam's going well, until it came down to her stomach, then to her waist, then bam. Penis. Did not see it coming, at all. I think my shocked expression for a split second caught her off guard, and she says, "Oh my god, I'm so sorry. I forgot to tell you, I'm transsexual." Yeah, I figured it out. Added for clarification. 1. I am a male. 2. Yes, I did have a chaperone, it was a female CNA. Not sure if she was shocked or not, BCI was really more or less focused on the exam. 3. In the ed, I usually don't look at the chart before going in, not sure if this is common practice, but usually, my attending just says to me, "Go see that patient in bed 4B, or go figure out what's going on with 13A. My mate in med school was a good-looking guy. He was doing his OBS and gyna or OB/GYN for the Americans term and had to do a vaginal exam on a pregnant 17-year-old girl. As he put his fingers inside her, she gave him a big wink and ground herself onto his hand. He immediately pulled out of there and left the room. Whenever we played the drinking game I have never from then on, one of the first lines would be, "I have never been raped in the fingers while at work." He would drink and we would all hug him and tell him it was alright and that we were his support group. My friend hurt his leg whilst playing football and I took him to the hospital. A young attractive triage doctor examining him had him in various positions whilst she felt his calves, Achilles, etc. When he was bent over on all fours I asked, straight-faced, if that position hurt. He said no, so I asked the doctor, "So it's okay if we still have sex then?" Doctor went bright red and stuttered. Guess so." My mate called me "you bastard." I cried laughing for a long time. Funny somewhat related story, my mom is an ER nurse and she had an unconscious intoxicated patient come into the ER. One of the nurses that works with her had just gone through a sex change, MTF. While she and my mom were examining this patient, he came to for a brief moment, long enough to get a hazy picture of what was going on. He saw the transgender nurse, stared for a few seconds and said, "You're the ugliest woman I have ever seen," then passed back out. The room went silent. The nurse then stepped back and everyone was bracing for tears when she shouted out, "He called me a woman." She was so thrilled he thought she was a woman, ugly or not. Was getting my first pelvic after giving birth a few weeks prior. My OB asked if a student could practice and I said sure. After labor you don't care anymore since by then you have had everyone and their mom look at your cooch. Anyway, a young attractive male walks in and sits down, obviously nervous. I think I was his first exam. Anyway, attempts to put the speculum in and after a few failed attempt he manages. It was so quiet in the room and I could feel him shaking and trying so hard to be gentle. I just said, "So? How about them bucks?" Everyone laughed and he lightened up a bit. Poor guy. Female well-endowed patient here. In my 20s. My doctor was using a stethoscope and listening to my lungs, saying take a big breath, then would move the stethoscope and say "Okay, now breathe." Normally. He tells me to lie on my back and then he puts the stethoscope on my chest again. I ask, "Are these big breaths or small breaths?" He turns beet red. He stutters, "Your breasts?" I say no, I am aware of the size of my breasts. I want to know what kind of breaths you want me to take so you can listen. And I died on the inside.